Good day, dear student. This is the third lecture of clinical and nutrition. We will talk about vitamins. Vitamins are essential organic carbon containing substances needed in a small amount in the diet for normal function, growth, and maintenance of the body. In general, humans require a total of about 28 grams of vitamins for each 70 kilograms of food consumed. Vitamins are essential substances where they are cannot be synthesized in our body, so we need to obtain them from food. Uh, for this, they are called vitamins because they are vital amines. Okay. In addition to correcting deficiency, a few vitamins have also proved useful in treating several non-deficiency diseases. يعني مثل ما انه الفيتامينات مهمة لتعويض النقص اللي يصير بالجسم، بعض الفيتامينات يمكن استخدامها لعلاج الأمراض مثل hypercholesterolemia or hypertriglyceridemia as a cholesterol lowering agent. Niacin in large doses, mega doses, can be used as a lipid lowering agent. Other functions of vitamins. They are important for energy metabolism. They are important for bone health, brain health, and body defense mechanism. Blood health is also important. And if you notice here, like it is not only vitamin D is important for bone health, vitamin C, vitamin K, and other minerals are also important. For blood health also, it is not only B12 and iron or folate. Vitamin K is important, B6 is also important, and etc. Vitamin can be divided into two broad classes based on the solubility. Vitamin A, D, E, and K are fat-soluble vitamins, while B vitamin and vitamin C are water-soluble. What is the significance of being either water-soluble or lipid-soluble? The solubility is important for studying the absorption, distribution, the metabolism, and also the storage inside our body. And this is very important to know about the storage of these vitamins, whether they are toxic or non-toxic. Here, as you can see, that if it is a water-soluble vitamin, it will be directly absorbed through the GIT and then go to the blood and then to the tissue. While the fat-soluble vitamin, it needs bile acid to be absorbed into, and it will be absorbed as part of the lipid absorption, fat absorption, and then it go with the chylomicrons and then into the liver. There are certain things that also can affect the absorption of lipid-soluble vitamins. For example, if a patient have cystic fibrosis associated with pancreatic insufficiency, which means that there will be malabsorption. Malabsorption of fat will lead to malabsorption of vitamins. The other drug, which is the orlistat used for weight reduction, also it can decrease absorption of fat and subsequently will reduce the absorption of fat-soluble vitamins. Mineral oil, which is used for cleansing the GIT before surgery or before endoscopy, also can bind to fat-soluble vitamin and lead to deficiency of these vitamins. Water-soluble vitamins deficiency. Unlike other water-soluble vitamins, vitamin B6 and B12 can be stored in the liver. So not all the B vitamins, which is water-soluble vitamin, are secreted in urine. Some of them will stay inside our body into toxic level if it is eaten in large amount, like B6 and B12. Symptoms of vitamin deficiency occur only when the vitamin is lacking in the diet and the body store are essentially exhausted. يعني مو رأسا يصير عندنا deficiency ثاني يوم. مثلا thiamine, absolute deficiency of thiamine from the diet, and then after 10 days the symptom will start. While vitamin C, after 20 to 40 days of vitamin C free diet. Toxicity from vitamins. For most water-soluble vitamin, when you consume more than the recommended dietary allowance or adequate intake, the kidney efficiently filter the excess from the blood and excrete these compounds in urine. As we said before, يعني مثل ما قلنا إنه عادة الوتر soluble vitamin إذا أكلتها بكمية عالية above the recommended dietary allowance, the kidney will filter the excess amount, except with B6 and B12, which are stored in the liver. Although they are water soluble, these two B vitamins may accumulate to toxic levels. For the the fat soluble vitamins, the highly toxic vitamin is the vitamin A, which is even in double the amount which is recommended daily. If you eat it, you will have toxicity of vitamin A. Vitamin A causes toxicity at intake as little as 2 times the recommended dietary allowance. Vitamin E and the water-soluble vitamin niacin, vitamin B6, and vitamin C can also cause toxic effect, but only when consumed in very large amount, 15 to 100 times above the recommended. Overall, vitamins are unlikely to cause toxic effect unless taken in supplement, usually pill form. يعني خلي خطين تحت supplement. يعني عادة الvitamins are non-toxic from the diet, but they are only or highly toxic if they are taking from supplement, which contain very large amount of doses. It is rare to develop a toxicity from consuming food sources of vitamins. The fat-soluble vitamin. أول واحد هو فيتامين A اللي هو أسماء أخرى ريتينال أو ريتينويك أسيد. ومثل ما كلكم تعرفون إنه vitamin A is important for vision, but also it is all important for other things like cell differentiation, growth, and also it is important for maintaining immunity and reproduction. Here, as you can see that the sources from animal food, they call it retinoids, while from plant food, carotenoids. And then they change inside our body into retinol, retinal, and retinoic acid. Vitamin A is highly, okay, first let me explain this graph. تشوفون انه هذا هنا جراف يعني يحتوي على the food groups زين وهاي كمية الفيتامين in each food group, okay, and this is what is recommended daily for a woman and this is for men. As you can see that vitamin A is highly concentrated in cornflakes, but be careful, it is fortified cornflakes. يعني هم مدعم بالفيتامين A. يعني هو مو naturally contain vitamin A وإنما fortified. Broccoli, carrots, tomato juice, okay. And here you can see that beef liver contain very high amount of vitamin A, even toxic doses. Beef liver contain very high amount of vitamin A. Sweet potato and mango. Vitamin A role in vision, as you can see, it's part of the rhodopsin. And to explain this, you can see that when light go to the retina, there will be a chemical reaction, change rhodopsin into opsin, and cisretinal here, as you can see, change into transretinal. The transretinal will lead to signaling, the neural signaling that go to the center for vision, and we can perceive the images, okay. And then when transretinal it will either change back into cisretinal or change into retinoic acid. When it is changed to retinoic acid, we can no longer use it with rhodopsin. So only cis-retinal can be combined again with the rods and to make opsin with opsin and then make rhodopsin. But this part will go away in the circulation. So nearly with each exposure to light, half of the retinal will change into retinoic acid, and this should be replaced by the whatever we have from the store in retinal. So if the patient have vitamin A deficiency, this process will lead to reduction in the cis-retinal concentration, and they will have a condition called night blindness. night blindness يعني شنو؟ يعني الشخص من يطب بغرفة مظلمة ويشعل الضوء، فرأسا راح تتعرض الرتنة إلى ضوء عالي. هذا الضوء العالي راح يشتغل على هذا التفاعل في الأوبسين والترانسريتينال، فتتحول إلى هذا الترانسريتينال do its action, but there will be loss of retinoic acid. So what will happen is that if the person is normal, his vision will recover quickly and can see the details again in a few seconds. يعني إذا كان عنده كمية كافية من فيتامين A راح يقدر بعدين يسوي adaptation ويقدر يشوف يعني الأمور أوضح، بينما الشخص اللي عنده inadequate vitamin A he didn't recover but remain blind for many seconds. يعني يبقى يعني not adapted to the situation for more time, for a longer duration than a normal person, and this is called night blindness. The other complications of vitamin A deficiency is keratinization of the conjunctiva. As you can see here, this is abnormal لأن احنا مثل ما قلنا إنه vitamin A is important for differentiation of the epithelial cell into mucus secreting cell. إذا ماكو فيتامين A راح تصير كيراتينايز مو mucus secreting cells، وبعدين طبعا إذا بقت الحالة استمرت راح يصير complete zero ophthalmia، يعني complete keratinization and the blindness of the patient. Okay. Vitamin D. Vitamin D مثل ما تشوفون إنه هو highly in high amount in fish and seafood, salmon, chicken, beef liver, eggs contain high amount of vitamin D. Vitamin D, all you know that it's important for bone formation and bone metabolism. The sources of vitamin D, either it came from the skin or from diet. From diet, vitamin D2 if it is from plants, or vitamin D3 or if it is from animals, while in the skin, when we expose to sunlight, there will be formation of free vitamin D3, and this go to the liver to form vitamin D3 calciol, and this calcidiol, and then calcitriol in the kidney, and this is the active ingredient or the active form of vitamin D that will work inside our body. Deficiency of vitamin D in children will lead to rickets because of the softness of the bones, defect in mineralization of the bone. In adult, it will lead to osteomalacia. There is other vitamin D function beside the effect on calcium metabolism and bone formation. They can affect endothelial function, smooth muscle cell, cardiomyocyte, dendritic cell, immunity, T cell, and macrophages. So it have a pleiotropic effect. It can work on different tissues as well. Vitamin E. Vitamin E is highly concentrated in oils like safflower oil, olive oil, sunflower oil, almonds. They contain high amount of vitamin E. As you can see from this graph, vitamin E is a major antioxidant in our body. Its deficiency will lead to hemolytic anemia because of the defect in oxidation of the free radical antioxidant. Here, this is the mechanism how vitamin E work. When inside our body during metabolism, free radical will be released. These free radical should be neutralized immediately. Uh, the most important antioxidant or neutralizing free radical neutralizing agent is vitamin E and vitamin C. Vitamin E will give an electron and this will neutralize the free radicals. Okay, and then vitamin C can give an electron to reactivate vitamin E again. Here, vitamin C, it will reactivate itself later on by taking an electron from another vitamin C. Vitamin K. Vitamin K is also a lipid-soluble vitamin, so it's highly concentrated in oils and also in kiwi and mustard. Vitamin K is important for clotting factor synthesis. مثل ما تعرفون 1972 يعني فاكتور 10 9 7 و2. These are the vitamin K dependent clotting factors. Vitamin K deficiency occur when there is fat malabsorption. Patients who suffer fat malabsorption syndrome such as celiac disease, cystic fibrosis, ulcerative colitis, Crohn's disease can develop vitamin K deficiency. Also, if there is a drug-nutrient interaction, antibiotic can kill vitamin K producing bacteria in the intestine, or anticoagulant drug warfarin interfere with vitamin K metabolism and activity, or even mega doses of vitamin A and E can interfere with the action of vitamin K. مثل ما قلنا vitamin K deficiency يعني يصير bleeding tendency عند المريض. Thank you very much and see you with the next lectures.